sorry, that's my clock. Also, I have 2 cats who may, you know, roam around at some point. All right, again, use the book and answer the end of the chapter questions, okay? Those answers will be posted on Wednesdays for you guys to look over and make sure that you understand. In your book, there is an online student resource through evolve.com. You can make an account with them and do extra study material. Do not wait till the night before to start studying for the quiz, okay? A lot of this material is hard to understand, and to cram it all into your head just by memorization the night before is not going to work, okay? Yeah.
I really had a difficulty signing to that app. So can you please, after class, like when the class finished, go over that?
Which app?
I think the Ava, or we had to register to a specific app.
For what app? I didn't hear you.
It was already posted in the class that we had to register for it.
Okay.
Get it out and send it to the chat box.
Okay, we'll talk after class.
All right.
Okay, so again, don't wait until the night before to start studying for the quiz. I do put, you know, the majority of the big stuff in the PowerPoint, but that is not to say that something from the book won't pop up on a quiz or an exam, okay? Review the material right after class and refer to your book if something is unclear, and if it is still unclear, you are more than welcome to bring a question to lab, or again, email me and we will set up a time that we can chat, okay? All right, so for this week, we have a lot of chapters, chapter 1, 6, 15, 16, and 19. So chapter 1 is going to talk about radiation history, dentistry and X-radiation, discovery of X-radiation, pioneers of dental X-radiation, a lot of history stuff. I will always put objectives in the PowerPoint. If you can answer the objectives, you are ready for the quiz. If you can't answer the objectives, you are not ready, okay? So use the objectives that are in the PowerPoint to make sure that you are prepared. Again, there is one drop quiz, but I can promise you that I do not want you to say, oh, I'm not studying for this quiz. This is going to be my drop quiz, because you know what's going to happen? The following quiz is going to be worse, okay? So do not say to yourself, I'm not, you know, this is going to be my drop quiz, because it happens all the time. I did it to myself and I see it done all the time. Do not tell yourself that. Study, study, study. And then when the midterm and the final come, you're not going to feel like you have to cram all this information in. If you're studying every week, which is another reason I like that we have a quiz every week, it forces you guys to study the material. That way, when the midterm comes up, it's not like, oh my God, I have to study all this stuff. All right, so the purpose of this chapter is going to introduce basic dental radiography terms. We're also going to talk about the importance of radiographs and review the history of X radiation. All right, so here are some terms. This first week, you guys are going to have a lot of terms. I suggest making index cards for the terms, okay? There's no way around it. You have to know your terminology. So radiation is energy carried by waves or stream of particles. X radiation is high energy radiation that's produced by the collision of a beam of electrons with a metal target, which is within the X-ray tube, which we will get into further, not this week. X-ray, that's a beam of energy that has power to penetrate substances and record images on your film or your sensor and then be brought into your computer. Radiology, that is the science or study of radiation, but as it's used in medicine, or in our case, dentistry. A branch of medical science that deals with the use of X-rays, radioactive substances, and other forms of radiant energy in the diagnosis and treatment of disease. A radiograph, this is your visible recording, your visible picture, okay? It's on a film or on a sensor. It's produced by the passage of X-rays through an object, and it's also called an X-ray film. We, a lot of times in private practice, start to call these X-rays, but technically is not an X-ray. So it also refers to a beam of energy. So your actual radiograph is your actual picture. Dental radiograph, that is a photographic image produced on a film by the passage of X-rays through teeth and related structure. And when I say film, I also obviously mean sensor, because film has kind of become something that's not used a ton, which we're very lucky for. So if I say film, I also mean sensor. Okay. All right, radiography, that is the art and science of making radiographs by the exposure of film to X-rays. Dental radiography is the production of radiographs of the teeth and adjacent structures by the exposure of film to X-rays. And the dental radiographer is any person who positions, exposes, and processes film or sensor. Okay, so a dental assistant, a hygienist, a dentist, we are all dental radiographers. All right, image, that is your picture of the object. That one's pretty self-explanatory. Image receptor, that is your recording medium. So an example would be your sensor. Okay, that's your receptor. You're going to hear a lot of times in clinic, we're going to say the receptor. That's the sensor. Okay, and dental imaging, that is the creation of digital, print, or film representation of structures. And the reason we take X-rays is for the purpose of diagnosis. So where's my, okay, so this is the reason we take images, okay? As a dental assistant and dental hygienist, we do not diagnose, okay? We can interpret X-rays, but we cannot diagnose. Can we see caries? Yes, but technically we can't diagnose. All right, so what is the importance of dental radiographs? So in dentistry, radiographs enable the dental professional to identify many conditions that may otherwise go undetected, and we can see conditions that cannot be identified clinically. So a lot of times patients could have something going on that we cannot visually see when we look in the mouth. Okay, so without radiographs, we cannot identify, detect, diagnose any of this. So you guys are going to get into private practice and you're going to have people who refuse X-rays, and that's a discussion you're going to have with your dentist and your patient, because if you have a patient refusing radiographs for years and years, you're going to have problems. All right, so what are the uses of radiographs? You are going to see this on your quiz next week. Okay, why do we use them? We can detect lesions. We can confirm or classify suspected disease. If patient's having pain, you take a radiograph to see if there's something there. You can localize lesions or foreign objects with the use of radiographs. You can provide information during dental procedures. You can educate your patients with the use of radiographs. You can evaluate growth and development. You can illustrate changes such as caries and periodontal disease, trauma. Does anybody know what type of radiograph will be used to evaluate growth and development?
Yeah.
Somebody said it, but it was too low. I couldn't hear you.
A panoramic?
Yep, a panoramic. So a panoramic, also known as a pan or a pano, I'll show you guys a picture later. That one is used to evaluate for growth and development. The main type of radiograph that is used to detect caries are your bite wing radiographs. Okay, make sure you write that down. All right, so radiation history. We're going to be talking about a bunch of different people, and unfortunately, you have to know these people because board loves these kind of questions, and you will see them on your quizzes as well. So the first one we have is Henrik Giesler. Okay, half these names you can't even pronounce. I can't pronounce. I don't know about you guys. So this was 1838. This is a German glass blower, and he built the first vacuum tube. Within your X-ray head is a vacuum tube. Okay, we're going to talk about that more in a couple weeks, but you need to know that he was the first one to do this vacuum.
Quick question. We have to know also the dates, correct?
You need to know the roundabout dates, not the exact date, but you know, if you tell me late 1830s, you know what I mean? You don't need to tell me like 1838. Okay. If I have a question on a test, it might give the date, but it's going to give more information than just the date. I'm not going to give you the date and ask you to pick out this person whose name can't even be pronounced. Okay.
Gotcha.
All right. Johann Hittorf is 1870. This person used the vacuum tube to study fluorescence, and he observed how fluorescence was changed within the glass tube. So he observed the discharge emitted from the negative electrode of the glass tube, which traveled in a straight line and produced heat, which resulted in a more fluorescent color. All right, so again, we're going to talk about the vacuum tube and the production of heat and all of that stuff that goes on within the X-ray head. But for now, you just need to know what he did. All right, he called these discharges cathode rays. Within the X-ray head, you have your cathode, you have negative and positive sections, all of that you don't need to know yet, all right? William Crookes, this was late 1870s. He was an English chemist, and he discovered that cathode rays were streams of charged particles. Philip Leonard was in 1894. He discovered that cathode rays could penetrate a thin window of aluminum foil that was built into these glass tubes. So he also noted that this fluorescence that was seen could actually glow. All right, here is William Crookes. All right, this guy, Wilhelm Röntgen. This guy is super important, okay? I cannot stress how important this person is right here. Very important. So Röntgen was experimenting with these different vacuum tubes and the fluorescent screens that were made by these previous people, and he noticed that the screens were glowing even though they were several feet away from the tube. So he determined that some of the mysterious rays were causing this fluorescence. And weeks later, he replaced the screens with a photogenic plate and recorded the images. Okay, so this is Röntgen, very important person. So Röntgen discovered X-rays on November 8th, 1895. He was awarded the first Nobel Prize in Physics in 1901. He is the father of X-rays. Okay, this is what you need to know about him. This is a big thing. Okay, also that he discovered X-rays, not necessarily the specific date, but he discovered X-rays. And he is the person who forever changed the practice of medicine and dentistry. All right, next person we have is Otto Walkhoff, and this was 1895. This is a German dentist who made the first dental radiograph. And he did so by using a glass photogenic plate wrapped in black paper and rubber in his mouth and basically exposed himself for 25 minutes. So that's lovely. Okay, C. Edmund Kells, this was 1896. Kells exposed the first dental radiograph in the United States using a live person. Okay, this is important, this part here. And he also exposed his hand to x-rays every day for years and ended up losing a finger, a hand, and an arm to cancer, and then later took his own life. So I guess that's the positive news for Friday. Really sorry. Okay, William Rowlands, this is the person who developed the first dental x-ray unit. And here's the radiation burn that I was talking about. That's why you have to protect yourself and your patients when you're taking radiographs. All right, Frank Van Wert, he was the first to use film in intraoral radiography. Let me explain the difference between intraoral and extraoral radiography. Intraoral is when the film or the sensor is placed inside of the mouth. Extraoral is when the film or the sensor or the receptor is placed outside of the mouth. So intra, in, extra, out. Does everybody understand that? Okay. William Coolidge was in 1913. He developed the first hot cathode X-ray tube. We're going to talk more about cathodes and anodes in a couple weeks. Don't stress about that too much. Eastman Kodak in 1913 manufactured pre-wrapped intraoral film, hence the name Kodak. If you guys have been in dentistry for a while, you know that when we used to use film all the time, I would say 98% of it was Kodak film. Okay. All right, Kells introduced the paralleling technique. Next week, we are going to talk more about the paralleling technique. Howard Riley introduced the bite wing technique. What did I say about bite wings? What do we use bite wings to detect?
Caries.
Caries, yes, very good. Okay. Fitzgerald introduced the long cone paralleling technique. Again, we're going to talk about the paralleling technique next week. This Numata in 1933 was the first to expose the panoramic radiograph. We talked about the panoramic earlier. That is a radiograph that's used to look at growth and development, and that would also be considered an extraoral radiograph because it's something that's outside of the mouth. Okay, so panoramic would be an extraoral, intraoral would be a bite wing. Okay. All right, so that was the first section. Does anybody have any questions about that history stuff? I know it's not very interesting. It's kind of boring. Anybody? Okay, so for chapter 6, we're going to talk about X-ray equipment, X-ray machines, film holders, beam alignment devices. I posted a picture on D2L of the beam alignment device that you guys use in clinic, which is called XCP. Here are the objectives for this chapter. Again, if you can answer the objectives, you're ready for the exam, okay? All right, so different types of machines. Some machines are used for intraoral radiographs, some are used for extraoral. Some units are portable, although portable units are not approved for use in Delaware yet. Delaware is always last in line. All right, so you need to know the parts of the intraoral X-ray machine. So first you have your tube head, which is this here, okay? Then you have the extension arm, which is this part over here. And the extension arm is just going to hold that tube head and allow you to move it around and position it where you need it. And then you have the control panel, which is usually on the wall. And in the control panel, you're going to have your on-off switch, your indicator light, exposure button, and a lot of the control devices, such as the time, the kilovolt peak, milliamperage, all of that stuff, which we're going to get way further into as the course goes on. But for right now, you just need to know those 3 main parts and what their purpose is. Okay, here are the portable units. That again, you can't use them in Delaware yet. I know PA uses a lot of them. So hopefully one day we'll get approved to use them. All right, dental X-ray film holders and beam alignment devices. So you have your film holder, which is the device used to hold and align intraoral dental x-ray films within the mouth, okay? So you don't just put the film or the sensor in the mouth. You need something to hold it in place, okay? When the patient bites down, it's going to move around. And then you have your beam alignment device, which is the instrument that's used to help us, the radiographer, position the PID. And the PID is, again, within this tube head part, okay? So it allows us to arrange this where it needs to be. All right, so here are some examples of film holders. Again, this is a device that's used to position the intraoral film or sensor in the mouth and retain it in position, okay? There's a bunch of different ones. This is a bite tab, this first one here. Then you have bite blocks, which these are what you are seeing. You can't see that, but these right here, where I'm highlighting. That's what's in your XCP. There's also a snap array, which is this one here. The film is kind of inserted into this snap array holder. You guys will learn more about that next year. And then this is someone used a hemostat here, which I have never seen used and hopefully never do. Okay, here are your beam alignment devices, your XCP, okay? This is what you guys use in clinic. Did everybody get to look at that stuff in clinic this week? Yes, okay. All right, again, here it is. Here are all the parts to it. There's a certain way to arrange this so that you make sure that you don't miss a portion of the tooth. They'll go over that with you in lab, and we'll talk more about that in class. All right, film types. Film types are very important. You need to know all of your film types, and you need to know when to use what type of film, okay? When I say film type, I also mean sensor type, all right? So size 0 is for posterior teeth of children with primary dentition, okay? So this is how you can remember this. Size 0, this is for kids with primary dentition, AKA they do not have any permanent molars or permanent posterior teeth, okay? So they have 0 permanent teeth. So it's size 0, all right? Size 1 is going to be for anterior and posterior teeth of children with mixed dentition. All right, so these children most likely have their 6-year molars. So they have 1 permanent tooth, okay? So size 1. And also size 1 we use a lot for adults, especially with anterior periapicals, because it's a lot easier, it's a little bit smaller for them to bite down on, all right? Obviously the sensors, they have no give in them, okay? When we used film, it used to give a little bit and the patient would be able to bite down, but the sensor is not bending, okay? Size 2 is for anterior and posterior teeth of adults and teens, and this is placed horizontally or vertically, okay? So size 2 is most widely used for teens and adults. It's for people with permanent dentition, and you can arrange this either horizontally or vertically. Size 3, it says here for bite wings, not recommended on adult patients, but it's preferred by some dentists. Size 3, you're really not going to see much of it, okay? And I will tell you, most offices that are using sensors and digital are probably going to have like a size 0, 1, and 2. You probably won't see the 3, okay? And size 4 is for occlusal film. All right. Anybody have any questions about the sizes? No? All right, so the next chapter is chapter 15, and this is on infection control and dental radiographer. So infection control basics, guidelines for infection control practices. Infection control has always been really important, but now with this whole pandemic, it is really blown up. So I had a student a couple years ago who told me that we don't pay attention to infection control. So I don't know where she got that from, but hopefully she's paying attention to it now. All right, so here are your objectives. Again, if you can answer these, you're ready for the test, okay? Please go back and read the objectives. I'm not going to read every single one. You guys don't need me here to read to you. All right, here's more objectives. All right, so basics for infection control. You guys have had infection control drilled into you for a long time now. I'm sure you spent a whole day in clinic, your first day, learning how to properly wash your hands. So that must have been fun. All right, so the primary purpose of infection control is to prevent the transmission of disease, okay? Diseases can be transmitted from patient to dental professional, can be transmitted from dental professional to a patient, it can be transmitted from one patient to another. So the primary purpose of taking these precautions is to prevent that transmission. Here are all your terminology for infection control. You guys have seen all of these terms. You need to know them across the board for all of your classes. All right. Personal protective equipment, PPE. Everybody knows what PPE is now that this pandemic happened. It's like everybody's like on top of this whole PPE thing. Everybody's like a pro. So you guys already know what this is. All right. Gown, lab coat, uniform. You are wearing glasses, goggles, whatever you want to call them. Masks. We're probably wearing 2 masks at this point. And this is to prevent skin and mucous membrane exposure when contact with blood or other bodily fluids, such as, in our case, saliva, is anticipated or not anticipated, but it's going to happen, okay? Gloves are worn by all dental professionals. We have to wear gloves. We're coming in contact with skin, blood, saliva, mucous membranes, all of that. Dental professionals must always wash their hands and put on new gloves between patients. You must wash and disinfect surfaces, use barriers, all of that. Does anybody have any questions about this? Because I feel like I'm just like drilling this into your heads, which you already know. Anybody? Please do not feel like you cannot ask a question in this class. Like, this class is an open forum. If you have something to say or add or a question, just talk. Okay. All right, masks and protective eyewear. Again, whenever there's spatter or aerosols, you have to wear eyewear. Okay, we already know that. Hand hygiene. Again, you guys, I know Mrs. Smiley had you guys washing your hands for an entire day of clinic last semester. So you know how to wash your hands. When this whole pandemic happened, they were like, oh, make sure you wash your hands with soap. What have these people been washing their hands with for the past however long they've been alive? I'm just like wondering, asking for a friend here, okay? All right, so again, if you want to read that, it's in your manual, go ahead, but you should know how to wash your hands. All right, sterilization and disinfection of instruments. This is very important. You're going to see questions on your quiz next week. I'm trying to make a star, but I can't really do that very well on this thing. All right, you need to know these 3 things: critical instruments, semi-critical instruments, and non-critical instruments. All right, critical instruments are used to penetrate soft tissue and must be sterilized after each use. And we don't use them in dental radiography. Can somebody give me an example of something that we use that would be considered a critical instrument?
Your instruments, like a scaler?
Instruments, scaler, explorer, good, very good. Anybody else? No, okay. Who was that just spoke?
Jenna.
Oh, Shannon, okay.
Oh, Shannon, sorry. I said probe.
Jenna,
Probe, yes. Okay, so any kind of instrument that's critical, okay? None of those are used in dental radiography, but you need to know, again, the differences between these, okay? Semi-critical instruments, these contact soft tissue, but do not penetrate. They still must be sterilized after each use, and if they're damaged by the heat, then high-level disinfection is required. Beam alignment devices are considered semi-critical, okay? So this is radiography. So this might be a good question for me to ask on a test. All right, okay. Beam alignment devices, which are also known as XCP, Okay, these are considered semi-critical. They touch soft tissue, they go in the patient's mouth, but they're not necessarily penetrating tissue. Okay, a lot of times there's a concern that because these are plastic, they can melt in the autoclave. And honestly, that's the least of the worries, because I wouldn't want something like this put in my mouth if it wasn't sterilized. I don't know about you guys, but I'd rather have it melt than be using it multiple times. All right, and side note, if they're put on the top shelf of the autoclave, they won't melt. Okay, non-critical instruments. These do not come in contact with mucous membranes. They are intermediate or low-level disinfectants, can be used. The PID, or your position indicating device, which was on the tube head, which I showed you a couple slides ago, that's considered non-critical. Okay, so that can just be wiped down with a disinfectant wipe. It doesn't need, obviously you don't take that machine apart and put it in the autoclave or anything like that. Okay. Anybody have any questions about critical, semi-critical, or non-critical? No? Is everybody still awake?
Yes, ma'am.
All right, perfect, perfect. Okay, cleaning and disinfection of the dental unit. I posted a lot of lab stuff this week, okay? And it tells you how to disinfect your dental unit, your dental radiology unit. I'm sure they're going to go over that in lab with you guys, but it's also on D2L. All right, barriers for film and sensor, okay? We use sensor now. Again, if I say film, I mean sensor. If I say sensor, I also am talking about film. You guys are not really going to use film until you get into DHY 213, which is next year. But for the digital sensor, this cannot be sterilized. Please don't take this and put it in the autoclave. All right, it will need to be covered in a plastic barrier and then disinfect it with an intermediate level disinfectant after removing the barrier and before using it on another patient. Okay, so there's little plastic sleeves that fit over your sensor. All right, and there are different sizes for size 0, 1, 2, 3, all the way. You cannot use a size 0 film cover on a size 2 sensor because it's too small and it's going to rip, and then saliva and everything else is going to get on here, and that's really gross. And you can also not use a size 2 film cover for a size 0 because it's going to slip out. Okay. All right. Any questions about that? Somebody asked a question. Come on. All right, no? Okay. Maybe later. All right, chapter 16. Okay, this is extraoral, intraoral radiograph examinations. We talked a little bit about this in the beginning. We're going to go back to it now. Again, here's all of your objectives. Make sure you can answer these. All right, extraoral radiographic examination. So this is a radiograph inspection of large areas of the skull or jaw. Okay, again, we said a pan. Let me see if I can. Okay, a pan or a panograph or a pano, that's considered extraoral radiographic examination. Okay, it's placed outside of the mouth, it's extraoral, and it looks at a large area. Okay, this image down here on the bottom left is a pan. I like the highlighter better. All right, so this one here is your pan. Okay. This one on the top left is the patient positioned in the pan machine. Anybody know what this one on the right here is?
Supplemetric.
Yes, very good. You guys won't be taking these in our clinic, but they are out there and you can explore larger areas with that. Okay, so that was extraoral. So now we're going to talk about intraoral. This is periapical, bite wing, occlusal. Can anybody tell me what the difference between a periapical and a bite wing is?
PA goes all the way down to the apex.
PA goes all the way down to the apex. And what about a bite wing?
Just mainly shows the crowns.
Or
Yeah, the
interproximal.
occlusal surfaces.
The interproximal surfaces.
Interproximal surfaces, it's only going to show the crowns. What was the other thing that was said?
Occlusal surfaces.
You're not necessarily, you can see a little bit of the occlusals. We're going to talk more about that because if you can see an occlusal carry on a bite wing, that baby is big. Okay.
Okay.
So sometimes you can see occlusals on a bite wing. I'm not saying you can't, but I'm just saying if you can, then they are pretty big. Okay. So the bite wing is used to see what?
Interproximal caries.
Interproximal caries. Very good. All right. So let's look at this. Okay. So here you have a periapical examination, also known as a PA. Okay. Periapical. All right. The purpose of this is used to examine the entire tooth from crown to root tip. Okay. Apex. And all of the supporting bone around the teeth. All right. With a bite wing, you can only see the crowns of the teeth. Okay. So with the PA, you're going to be using this more so if a patient, say, comes in and is experiencing pain, you're going to need to be able to see the apex. If you take a PA and you cannot see the apex, you have not taken a very good PA. Okay. But that's why you're here. You're going to learn how to take them. All right. So you need to be able to see the entire tooth, crown to root tip and supporting bone. Again, this is a periapical, also known as a PA. And the techniques in which it can be obtained are through paralleling or bisecting, which we're going to talk more about paralleling next week. Bisecting, you guys will not really talk about until second year. Any questions about the PA? Okay. All right. Interproximal or bite wing examination. So the main purpose of this is to examine interproximal surfaces. Okay, that is the main purpose. Okay, we cannot see interproximal caries as well on a PA. You definitely can't see interproximal surfaces on a pan or an extraoral radiograph. Okay, so this is what you use to see interproximal. This examines the crowns of both maxillary and mandibular teeth on one single film. So here you can see, I can see maxillary teeth and mandibular teeth. Okay, I can see the crowns. I cannot see the apices. All right. Anybody know what they're seeing in between here, between the teeth?
Radiographic calculus.
Radiographic calculus. Very good. All right, and that's why we're here. Okay. All right. The size for this would normally be a size 1 or 2. Okay. Again, you're not going to really see the size 3 used at all. What's the size 4 for? Used for, I should say.
Occlusal film.
Occlusal. Good. All right. Here is your occlusal. Okay. Size 4. This is the occlusal technique. You guys, again, will learn how to take occlusal images most likely next year. And this is used to examine large areas of the maxilla or the mandible on one single film. So you can only see, what am I looking at here?
Mandibular.
This is the mandibular, okay? If this was maxillary, this would all be filled in with bone and therefore it would show up more of this whiter color, okay? So because it's really dark, shows that there's only soft tissue here, which is the tongue, okay? So this is examining larger areas, not obviously as large as a pan, but you can see larger areas on this. How is this different from a pan? Is this an extraoral or intraoral?
Intraoral.
Intraoral, good. All right. So
How do
dental
we know-
X-ray, yes.
How do we know that it's extraoral film?
This is an intraoral film, okay? You would take it with the patient kind of opening and you would place the film or the sensor like right over the teeth. This is intraoral because you can see, you're almost looking down at all of these teeth. See how I'm looking down at the occlusals?
Yeah.
Whereas if it was extraoral, it would look something like these,
Okay.
okay?
Yeah, makes sense.
Okay.
Thank you.
Yep. All right, so, okay, this is very important. You guys all semester are going to be asked questions about radiolucent and radiopaque. Do you like my highlighting skills? I think that's really good. Okay. All right, so dental radiograph appears black and white image with a picture of varying shades of gray, okay? So we have radiolucent, which is known as RL, okay? And then we also have radiopaque, which is known as RO. Radiolucent is the part of the processed film, okay? And I say processed film, but also when you use a sensor, that image that comes up on your screen, it's going to be black or dark, okay? And that's because this structure is lacking density, okay? So what that means is when I took the x-ray, all of those x-rays were able to pass through, okay? So it showed up darker, okay? So there's not much density there. It lacks density. You need to know that. When you have a radiopaque area, it means that this film is very dense and there was some type of structure there that was stopping the x-rays from passing through as freely, and it's going to show up a lot more white. Okay, so I'm going to go back to this occlusal exam for 1 second, okay? So again, if you remember before I said, you can tell that you're looking at the mandible here because in this area here, it's very dark, okay? So what would I call this dark area? Radiolucent or radiopaque?
Radiolucent.
Radiolucent, yes. Okay, radiolucent, does it lack density or does it have density?
Has density.
Black.
Lacks density.
Lacks density, okay? Here's how you can remember. RL, radiolucent, lacks RL, okay? Lacks density, okay? And going back again to this occlusal film, you can see the teeth here and the bone, they're all showing up more of a white and grayish color. So would that be radiopaque or radiolucent?
Radiopaque.
Radiopaque, yep. And is there more density there or does it lack density?
Density. There is
Okay,
density.
it's dense, yep. So again, x-rays are trying to pass through, okay? Picture yourself taking an x-ray on someone, okay? If it's soft tissue, those x-rays are going to go right through with no problem. Once it hits bone, it cannot penetrate that as much, okay? Yes, x-rays are still going to go through, but not as much. So you have much more dense, much more radiopaque, lighter, whiter, more shades of gray, okay? If you can visualize this occlusal exam, obviously in this section here would be the tongue, okay? So that's soft tissue. So x-ray is able to penetrate, so it's darker, okay? It lacks density. Same thing here. This is like the bottom lip here, okay? So it's lacking density, but then you get to where the teeth are and the bone, and it's a lot more dense. Does anybody have any questions about that? Does that make sense? Yeah. Which dark spot? Here?
I think on teeth number 31.
On 231. That would be on this side.
Yeah, or 30.
They're looking at,
Oh, I see it.
yeah.
That is probably some sort of, that might be like some sort of canal or something that you can see there. Okay. And we're going to get into all of that stuff. You guys are going to be able to look at a radiograph and tell me exactly what you're looking at. But in order to do so, you have to know radiolucent versus radiopaque. All right. So again, radiolucent is known as RL. So on a quiz, I might say, what is the radiolucent area of number 1 pointing to? Okay. So you're going to need to first identify radiolucent as dark, black, lacking density, okay? Or radiopaque, which is going to show up more of like a whitish with grays in it, and it's much more dense, okay? All right, so here we're going to look at radiolucent versus radiopaque again, okay? So air spaces, which is where this arrow is pointing here in the top left, show up dark, okay? Because X-rays are freely able to pass through air spaces, so they're going to show up dark, okay? There's nothing there stopping X-rays from passing through, so they're freely passing through, they're radiolucent, and they're lacking density, okay? Some dense structures on the bottom right, if you look at number 1, it's showing the enamel, which is that outer layer of tooth, okay? Then you have number 2 pointing to the dentin, okay? And then bone, which is showing number 3 down here. Okay, these are all dense structures. They show up much whiter or grayer than the airspace, okay? Even here, you can see air spaces between the teeth, okay? So X-rays that can pass freely through are going to show up dark, black, lacking density, and when you have stronger surfaces and structures, it's going to stop that passage of X-rays, and those areas are going to show up radiopaque. So enamel, dentin, bone, all of those areas are much more dense, okay? Does that make sense?
Mm-hmm. Yeah.
Okay. Please make sure you understand the difference between radiolucent and radiopaque. You are going to have to identify structures. All right. Okay, so we are going to now talk about bite wing technique. I think this is the last section. All right, so again, we already talked about the main purpose of bite wings, which is what?
Caries.
Carrie.
What type of caries?
Interproximal.
Interproximal, yes. Okay, so you need to know, again, your step-by-step procedures, bite wing technique, modifications, all of that, okay? So here are the objectives. All right, so your bite wing technique is a method used to examine interproximal surfaces. We talked about that a million times. All right, so interproximal means between 2 adjacent surfaces, which I think you guys understand. Interproximal exam is the intraoral exam used to inspect the crowns of maxillary and mandibular teeth on the same or single image, okay? Your bite wing receptor is the type of receptor used for interproximal exam. What size sensors can you use for bite wing?
1 and 2.
1 and 2, very good. All right, alveolar bone. This is bone that supports and encases the roots of the teeth. So we saw that on the PA. You see that here. Okay, that's all of your bone. How does bone show up on a radiograph? Radiolucent or radiopaque?
Radiopaque.
Radiopaque.
Radiopaque. And what's the abbreviation for that?
RL.
RL. Hold
Yep.
on.
RO, radiopaque. Yep. Okay. Crestal bone. This is the portion of, this is the coronal portion, I should say, of alveolar bone that's found between the teeth. Okay. So when you look, let me go back here. This is the most coronal portion. Okay. Okay. Contact areas, that is the area where the tooth touches the adjacent tooth. What is important about when you take a bite wing? What's important about those contact areas?
They can't overlap.
They cannot overlap. Very good. If your interproximal or contact areas are overlapping in a bite wing, it's going to inhibit you from detecting caries. So therefore your bite wing, your purpose of your bite wing kind of just went out the window. Okay, so you need to have open contacts. That's what's open contacts. All right, horizontal bite wing. This is when your receptor is placed in the mouth with a long portion of the receptor in a horizontal position. You can also take vertical bite wings. All right, and then we just talked about open contacts. They appear as thin radiolucent lines between the adjacent tooth. That was those air spaces that we were looking at. All right, again, overlap contacts. This is where the contact area of one tooth is superimposed over the adjacent tooth. Therefore, you cannot see open contacts and you cannot see what?
Caries.
Caries.
What type of caries?
Interproximal.
Proximal.
Interproximal, very good. All right, vertical bite wings. This is when the receptor is in the mouth with a long portion of the receptor in a vertical direction. And does anybody know why you would take a vertical bite wing opposed to a horizontal bite wing?
Bone loss.
Bone loss.
Bone loss, yes, very good. So if you have a periodontially involved patient, you want to take a vertical bite wing, okay? When you take, normally it's 4 bite wings, okay? When you take your bite wings, if you cannot see crestal bone in the first bite wing, you need to switch to a vertical, okay? We do not want to come over and see 4 bite wings with no crestal bone. If I come over and I see 1 bite wing that has no crestal bone and then that you switch to vertical, great job, okay? But if you cannot see crestal bone in that first one, do not continue to take horizontal. You need to switch to vertical, all right? All right, beam alignment device and bite wing tabs, we already talked a little bit about this, but again, this is used to position an intraoral receptor in the mouth, maintaining the position during the radiographic procedure. Does somebody have a question? No,
That's me.
I'm sorry.
that's okay. Do you have a question?
No, it's just my husband making noise. Sorry.
Oh, okay. No problem. No, that's fine. You're all set. All right. Bite wing tab. Okay, this is, again, I showed you a picture of the tabs in the beginning. It's cardboard, something that fits around the receptor, and it's used to help stabilize during the procedure. A lot of times you're going to use bite wing tabs on children, okay, because they have a hard time with that bulky XCP. All right. So that is usually the time you're going to use bite wing tabs. And there are different sizes and there are different ones that can be used for horizontal versus vertical bite wings, okay? We are going to talk more about bite wings in chapter 19, which will be in week 3, okay? So when should you switch from horizontal to vertical bite wing?
When you can't see the crestal bone.
Yes, very good. Crestal bone. You must be able to see crestal bone. Okay, do not continue to take all 4 bite wings with no crestal bone. All right. Again, if we see that you took 1 and you switch to vertical, we're not going to mark you down. All right. But if you proceed to take all 4 and crestal bone cannot be seen, you're going to get marked down. All right. Again, here is your online resource. It's within your book. It's like a step-by-step thing. There's a code in there you can download to use extra resources. Does anybody have any questions? I know we covered a lot today. If you are a dental assistant, you are going to have an easy week. And if you're not, that is fine. You're going to learn a lot. Okay. But who has questions?
I know you said this like 3 or 4 times, but I was trying to upload the PowerPoint so I could take notes.
Yep.
You said to ensure that we understand the objectives at the start of each chapter. And then what did you say about where you'll post the answers?
I will post the answers to the end of the chapter questions on Wednesdays. And I'll post them to D2L.
And the end of the chapter questions are in the book.
In the book, yep. The workbook
Okay.
is more so for you to kind of practice your knowledge. And again, I'm going to pull pages from the workbook and post them on D2L as your extra credit. So I will post the extra credit for next week's quiz today after class. And again, the extra credit needs to be submitted to me prior to the start of next week's class. Please, we're not done. I still have one more thing to go over, okay? So I know you guys are getting antsy and we should still be done early, but try to hang in for a few more minutes. Make sure that you do not take a picture of the extra credit because some of them are like crossword puzzles and stuff. and it jumbles the whole thing when it gets sent in an email, and I can't read it. And I cannot, like, it just drives me nuts. So please if you don't have a scanner, please download the Adobe Scan app to your phone. It's super easy to use. You literally take a picture and it turns it into a PDF file, and then you can just send it right over to me. Okay.
All right. So the end of the chapter questions are in the textbook, and the extra credit questions are from the workbook.
Right, but I will post exactly what the extra credit is, okay? So I really encourage you guys to use the workbook at your own pace, and if I end up posting a page that you already did, then hey, use your Adobe Scan and send it over to me, okay?
Mm-hmm.
But again, if it is specifically extra credit, I will put that on D2L, and you will know exactly what will be counted towards extra credit. Don't start sending me all these pages that you did in your workbook. I mean, props to you if you did it, but I can't promise extra credit for every single page. Okay, I like extra credit. I think it's a great way to encourage you guys to study and obviously to gain some extra points, but you know, I can't be, you know, giving out extra credit all over the place. All right. So again, extra credit needs to be turned in before 12:30 next week, please. I have to keep this across the board. I cannot make exceptions for one person. I don't want anybody to feel like I'm favoring one person or the other, or I made exception for this one, but not for me, and blah, blah, blah. That stuff needs to be turned in before 12:30, okay? Just email it over before 12:30. I know you guys have lab in the morning, so really try to get it in on Thursday night, okay? And it will be applied to the quiz. All right, I have one more thing that I want to go over, and then I will let you guys go. Oh, stop this. Anybody else have any questions about what we went over today? Intraoral versus extraoral, radiopaque versus radiolucent, anything? No? Okay. All right, let me go out of this. All right, so like I said, I did post a lot of stuff on D2L last weekend, and I titled it like, I don't know, first lab or lab 1 documents or something like that. So this is under there. It's somewhere, okay? Does everybody see this?
I can see it.
Okay. So you guys need to go back there and read this, okay? I can promise you that next week on your quiz, you are going to see questions coming directly from this page, okay? And this page is basically telling you what type of x-ray corresponds, okay? So maxillary central incisors, and this is the periapical or PA. So the sensor film is placed vertically with the central incisor centered. You also can see the mesial of the right and left lateral. So I might give you, you know, this portion, and I'm going to ask you to tell me which one it goes with. Or I might give you this portion and ask you which one it goes with, okay? Read the entire thing, okay? Because if I give you one for bite wing and you only read the first half, you might think that I'm talking about, you know, a molar PA, but I'm really talking about maybe a molar bite wing. So read the entire thing, okay? Again, this is on D2L. It's under the lab documents. All right, so somebody tell me, how do you guys do your quizzes normally? Like, do you log into your class and then start the quiz as a whole, or how do you guys normally do that?
We usually log in and start the quiz as a whole.
Okay, all right. And you guys usually like have your cameras on and all that jazz? Okay, all right. So I'm gonna give you this little spiel. I'm sure you've heard from everybody. If you guys, okay, so you guys are at home, all right? If you guys need to study for the quiz, you need to act as if you're taking this quiz in class, okay? If you guys use, you know, your notes and all this other stuff, that is, bottom line, it's on you, okay? When it comes time for boards, you're gonna be kicking yourself in the behind, all right? So study for your quizzes, take them with no notes, take them as if you were sitting in class taking them, okay? that's my spiel. I cannot stress about, you know, who's using notes and blah, blah, blah. You need to take them, you need to be, you know, honest when you take them, and you need to be mostly honest with yourself, because you do not want to go into next year and start studying for boards not having any of this already in your mind, okay? All right, does anybody have any other questions about anything? So next week, we're gonna start at 12:30. We'll start as a class, everybody will log in, we'll say hello, and then we'll do the quiz, and then we'll do the lecture. Now, I'm going to tell you, next week's lecture is a long lecture, and it normally does run over. And with the quiz next week, I'm anticipating that we're going to run over, okay? But there will be a lot of days where you guys get out early, so don't hate me too much next week, okay? Does anybody have any questions? It was nice meeting you guys via Zoom. Hopefully one day I'll be able to see you all in person. But does anybody have anything that they want to add or any questions before you guys go? No. Okay, so I will post the extra credit online. Did anybody have a hard time getting the textbook from the bookstore or anything?
Yes. I haven't
Yeah,
gotten my